In this episode of the Animals Naturally podcast, I'm pleased to introduce you to Dr. Kevin Toman. He has been a veterinarian in the USA for nearly 4 decades. His work centres on merging evidence-based medicine with longevity science for pets. He specialises in helping pets, particularly dogs and cats, to manage chronic pain and serious conditions by combining prescription longevity medications, different supplements and lifestyle modifications for a holistic approach to helping animals live as long and healthier lives as possible. So without further ado, let's listen to this conversation with Dr. Kevin Toman. Hi Kevin, thank you so much for coming on to the Animals Naturally podcast. Can you start by introducing a bit about yourself, a bit about your career?
Yes, my name is Dr. Kevin Toman. I live on the coast of California in the U.S. I've been a veterinarian for 40 years and have been passionate around the care of older pets for about half of that. And so these days I run a specialty consulting practice at www.helpingpetslivelonger.com, where I use a combination of consults, proven supplements, and prescription longevity drugs to help pets across the U.S. and in the U.K. live their longest and best lives.
That's great. Thank you so much. So, how did you become interested in helping older pets and older animals? Is there any particular reason that you've come into that field?
Well, as I mentioned, I graduated from veterinary school back in 1986. So I've been in the veterinary game for a good long time. And in the veterinary world, perhaps like the real world, quote unquote, things tend to happen in cycles, Suzanne. And so at one point, about 15 years ago, I ran into a situation where within the space of a week or two, I saw 3 or 4 older pets who had been effectively orphaned. In other words, they had lost their pet parents, whether they be older human females or couples in one case that died in a car crash. And so these were older pets that unfortunately had to be rehomed late in their life. So they were being put into a shelter setting. And it was just heartbreaking to me. And so the reality is that since that time, I'm pretty active in shelters for older pets. And the other manifestation of this passion is the fact that I do run helpingpetslivelonger.com. I mean, older pets run into 3 or 4 problems on an ongoing basis: cancer, chronic pain, dental problems, kidney disease, and these are all things that you and I can take a shot at helping improve their life and live a longer life as well.
Um, have you noticed any changes over the years? Obviously, you've got a long career, and I know personally for myself, just the animals I've had over my lifetime, veterinary medicine and different therapies and approaches has evolved. Have you noticed any particular change in perhaps pets living a bit longer, maybe, or any particular ailments that may be becoming more prevalent as pets are getting older?
Well, you're exactly correct, Suzanne. There are 2 trends that I would say I've found over those 4 decades in veterinary practice. One is the fact that, in fact, pets, as a rule, are living longer. And I attribute that in general to better diets and the fact that veterinarians, schmoes like me, can use better diagnostic techniques. Now we have not only X-rays, but also CTs or MRI studies or whatever the case may be, so that we can do a better job of diagnosing pets early in the game. And that's something that you and I can talk a little bit more about if you'd like. So that's the good part. That's the good trend that I have seen. The bad trend that I have seen is that just as with humans, the biggest threat to a pet's longevity is many times their body weight. And so, I've seen pets gradually increase their, they're just becoming more and more obese, perhaps like some humans. And, that is shortening their life. So let me tell you a quick story about that. About 10 years ago, that was the heyday of weight loss TV shows here in the United States. And so there were shows like The Biggest Loser, et cetera. And I was running a pretty good sized veterinary clinic at that point in time, had almost 5,000 pet parents that I was helping. And so I thought, Suzanne, I'm just going to, what a wonderful marketing strategy. I'm going to put on the biggest pet loser contest within my practice. And I'm going to give away, for $1,000 in veterinary care or whatever the case may be. So I sent out a big newsletter campaign, a big email campaign. You know how many responses I got back from pet parents who thought their pets were obese? None. Not one response because pet parents look at their pet and think, oh gosh, he or she, they're not heavy. They're just, a little chubby or whatever the case may be. But the reality is that from a veterinary perspective, the extra pounds that or extra kilos, to put it in your jargon, the reality is these things are costing our pets their lives. And so whatever you and I can do to keep pets thin will pay off big time for them longer term.
Yeah, that's really interesting. I know when I take my dog to the vet for his annual, he gets an annual checkup, he gets put on the scales. Yeah, and
Hmm.
they obviously got, and I was quite last time I went, I remember they had a little graph where they showed the change as he the year
Yeah.
before he had to lose a little couple of kilos, a few pounds.
Yeah.
Yeah, so it's interesting you say that, but you looking at them, you don't really necessarily if you're seeing your dog every day, you don't necessarily or your cat or whatever pet it
Right.
is, you don't necessarily notice, do you? Or you don't necessarily think
Yeah.
about the effects, but you're absolutely right. It puts strain on the joints, doesn't it? And all, on your heart and all sorts of ailments.
Yeah, absolutely. And we found that obese pets are much more prone to cancer. And same thing is true in humans as well. I follow human longevity science quite deeply, and there's study after study showing that the heavier human individual is, the more prone they are to cancer. Same thing applies to our dogs. Let me tell you one other quick story, and then and I apologize for that, but the American dog food company Purina put on a study about 15 years ago. And in that study, they took litters of Labrador puppies, Suzanne, and they divided the litters in half. And these were a number, there were 20 or 30 litters of dogs. And so they fed half of these Labrador Retriever puppies just as much as they wanted to eat all day long. And then they fed the other half of the same litter about two-thirds of what their calculated maintenance requirement was. So in other words, they were only getting about two-thirds, maybe even half of the calories that their little siblings were. And then they studied these pets throughout the course of their lives. And at the end of the day, the litters of puppies that were kept thin lived 1.8 years longer, almost 2 years longer, without any other difference in their care. They were vaccinated the same. They spent the same time in the same building. There was just no difference except for their body weight. And again, the thin puppies lived almost 2 years longer. So that tells your listeners, that tells you and me, there's a simple truth in here. And you and I can talk about much more complex strategies to helping a pet live longer. But if you want the simplest and the approach that will actually save you money, why don't we start by simply keeping our pets as thin as possible?
Yeah, I think a healthy weight is really important, isn't it? I think it's easy to not necessarily people could get overwhelmed. I think sometimes by looking at different pet foods that you can buy is sometimes it can be quite a
Yeah,
minefield. What is the ingredients? What actually are they? What is the source as well, isn't it? Sometimes the source chicken isn't necessarily just chicken, is it? It can depends where it's come from
right.
and exactly
Sure.
there's so many different things people don't necessarily I think people get overwhelmed, can't they? Do you think that might be the case in terms of what people when they go to buy some food, what the overwhelmed with choice?
Absolutely. Oh, you're 100% correct, Suzanne. I mean, the reality is that there are hundreds of pet foods out on the market. And so, how are you and I supposed to really know what is best for our pets? And certainly part of that is just simply, there might be an individual dog or an individual cat who is sensitive to chicken or sensitive to fish. And so when they eat those products, you see skin problems, you see vomiting, you see diarrhea. And so that becomes relatively easier to change because gosh, if my cat is vomiting on fish, well, why not try a non-fish diet? That's common sense for us all. But and listen, I'm 66 at this point, and so I have an admission to make. For much of my life, I have fed my dogs, my cats, kibbled diets. But one of the things we're now learning is that the average kibble diet is really not a very healthy approach in feeding our pet because those kibbles are filled with carbohydrates. That's the only way that those kibbles can stay together is by adding sugars to them. And then they're baked at a very high temperature. And those sugars, as they are baked at very high temperature, they undergo a change, a chemical change into a metabolic byproduct, or excuse me, uh, a cooking byproduct called AGEs, or advanced glycation end products. And the moral to the story is that these are known carcinogens. So, unfortunately, the average kibble diet may not be as healthy for our pets as you and I would like.
Yeah, I'm really glad you mentioned that. I mean, I moved my elderly dog who I had he died a few years ago now, but I realised towards the end of his life that the whole the kibble type food I was feeding wasn't doing him any, it didn't do his teeth any good. I've been so
Yeah.
careful. I'd loved him to pieces. I would never have given him food that I didn't really think was good. But I put him on a
Yeah.
raw food diet at the end. And my dog that I have now, he's on a raw food diet and has been since I've had him. And he
Hmm.
definitely healthy. I think it's the thing like people sometimes think that loose bowels or being a bit sick occasionally or whatever, it's like just what happens. But actually, I personally, obviously I can't speak for everybody, I personally have found my dog is so much healthier and everything about him is good and because he's on the raw food diet. But I suppose kibble, would you say is equivalent to processed food for humans? Us going to the supermarket and buying a processed meal, I suppose, would you say?
Absolutely. Absolutely. 100% correct, Suzanne.
Yeah, yeah. So, I was going to ask you what sort of challenges you found in caring for pets who are older. I think we've obviously talked a bit about nutrition being definitely a challenge and the obesity potentially causing health issues. So, any other
Mhm.
challenges you say you've found, I don't know, either directly or indirectly working with your clients?
Well, as somebody who cares so deeply for older pets, I would tell you that there are in fact three or four common diseases are that I see every day in this demographic of dogs and cats. And if you have a dog or a cat, excuse me, a dog under 25 pounds or a kitty, one of the first things that you have to understand is that their dental health is really a primary driver of how long you will have them. Because if you're not doing regular anesthetic dentals, and hear me out on this because I know it can be a controversial topic, but the reality is that the infections and inflammation and pain that are present in your small dog or in your cat are shortening their life by up to about 15%. So at least here in the US, every year you hear a number of different quote authorities say, "Oh, you don't need to use an anesthetic when you're cleaning a pet's teeth. You can do it while they're awake and just simply hold them and scrape their teeth or whatever." But one of the things we know, Suzanne, is that almost 85% of the true infections, the true sources of pain, live underneath the gums. And there is simply no way for a veterinarian like me or for somebody, a loving pet parent like you, to know whether your pet has dental disease without taking x-rays of their teeth, just like our human dentists do for you and me. And the only way that those x-rays can be taken is with anesthesia. And so that's why an anesthetic dental is really the best friend of your small dog or your cat when it comes to extending their lifespan.
Yeah, I think it's a really good point, isn't it? As I said before, I think my other dog he had quite bad teeth, and I was horrified. I've been feeding him these I won't name the manufacturer, but I was feeding him these things that are supposed to daily treats to help the teeth, and they perhaps weren't as
Hmm.
good as they should have been. So otherwise he wouldn't have had to have teeth removed. But
Um,
yeah, I was thinking about my horses that I've had. The yours the vet obviously finds it much easier to have a good look if the animal is sedated
yeah, yeah,
because
sure,
otherwise you
absolutely.
can't like you say with us as humans, isn't it? If people really terrified of the dentist, they probably have to go in, don't they, eventually to have some kind of be tranquilized in some fashion to
Yeah.
have their mouth
Hmm.
looked at because yeah, and you're right, if you can't eat then you that's going to affect your health generally, isn't it? And that's the same for our animals, isn't it? And I think it's interesting. You said earlier on about obviously that study where the dogs lived nearly 2 years longer, or 1.8 years longer, and talk about sort of 15% sort of difference as well just now. And I think it doesn't sound an awful lot, but I think with animals, with the fact we have them for a relatively short part of our lives, actually that for them it's a massive difference, isn't it? It's a massive impact, and that's really, and why shouldn't they have their best lives, healthy lives?
Absolutely.
Mm.
Yeah, and I think by working together and by studying the data, studying the science that is out there, I think you and I and the pet parents that are listening to your podcast, it can absolutely extend our pets' lives by up to 25, some maybe even 30%. It's not that hard to do. Now, one thing alone will not make that change. But if you add in dental care and keeping your pet thin and using the best diet and thinking really hard about whether vaccines are the right approach for your pet or not, using the prescription longevity drugs or proven supplements that we could talk about. The reality is that taken cumulatively, not just one at a time, but if you and I do all those things, the reality is that I think we can extend our pets' lives by up to a couple of years, and that's a long time for our pets.
Yeah, and I think you've hit the nail on the head there, that integrated approach, isn't it? I think it's the same with human health, isn't it? Obviously,
Absolutely.
if we go out for a long walk every day, that's going to help to some degree. However, if we then
Uh-huh.
eating junk food rest of the time, it's only going to have a limited effect, isn't it? It's not going to maximize the potential, isn't it? So, talk about
Right.
supplements. Is any supplements you particularly recommend? Or obviously, it will vary, of course, to the ailment and the pet type. But is there anything you recommend particularly?
Yeah, and so what I would tell you is I'm going to retrace my path just a little bit. And if you have a cat or a small dog, far and away, the number one concern that you have to worry about is dental care. And by the way, you spoke about not knowing whether the treats that you bought or the flush that you bought was effective. And if you or your pet parents who are listeners want to use products that have been proven effective, there is a council called Veterinary Oral Health Council.com. So if you go to vohc.com, you will find a list of products that are proven effective for both dogs and cats. Because the reality, Suzanne, is you're exactly correct. There are hundreds of products on the market designed to, quote, help your pet's teeth. But most of them don't go through the studies needed to prove effectiveness. The products that are listed on the vohc.com website are proven. And so that's where I would point your listeners. Now, you asked me a very specific question, and that is what supplements are best for pets, or what would I choose to talk about? And so, while for these small dogs and cats, dental care is the number one issue for them. For larger breed dogs, the number one concern that many pet parents have is their orthopedic health, the aches and pains that accompany life as a large breed dog. And one of the things that we have learned over the last 5 years is that glucosamine and chondroitin products like Dasiquin here in the United States, for instance, things that I sold for 10 or 12 or 15 years within a veterinary practice, now we know don't work. Let me repeat that. Glucosamine and chondroitin joint supplements do not work in either humans or pets. And there are a number of studies to prove this. And so when you and I look at the best approach, for instance, to help older, large pets remain as comfortable as possible, I'm going to tell you that the number one natural supplement that is backed by all the science right now is a product called undenatured type 2 collagen, or UC-2 for short. And it's been proven to reduce joint pain as much as drugs in both humans and dogs. So if you have an older large breed dog, please look for products containing UC-2, and you'll go a long ways towards helping them. Other things that will help these older pets with joint pain are simple fish oil, the same product that you and I have been taking for years, and actually CBD, the hemp-based marijuana analog that is fairly common over here in the US, and I can't speak to its availability in the UK. But if you have an older pet that is painful, the reality is the combination of undenatured type 2 collagen, fish oil, and CBD would be a great choice for them. These products are proven safe, they're proven effective, and they will help your older pet.
That's really interesting, isn't it? I think it's good to hear there's more research. I think that's one of the things I've found frustrating over the years through having my Taranet website on holistic therapies is actually the lack of evidence. And some people are so skeptical to lack of
Absolutely.
evidence. But I think getting research, people don't necessarily realise how expensive getting research is and how some of the studies that say natural therapies or different approaches don't work are basically sponsoring the studies, and there's not in their interest to necessarily come out with the
Yeah,
result to say. So it's a very
right.
not a very black and white field, is it necessarily for people to
It
navigate?
isn't, and you're exactly correct, Suzanne. Many of the studies that are on the market have a corporate sponsor, and they are looking to prove that their product works or that a competitor's product does not work. And so it takes a lot of effort to kind of sift through these things to really determine the best path for your pet. And that's one of the things. I mean, I only sell about 16 supplements on our little website, but I can tell you exactly why every one of them is there and why they work. And so if, here in the United States, people look at a big website like Chewy, and there are hundreds of veterinary supplements on there, but not many are proven. Not many have a veterinarian that can stand behind them and tell them why these work and why these other ones do not.
No, it's really, really sounds really, really good. I should, people can look at your website definitely after this, listening to this podcast. I'm sure they'll find it really fascinating. Um, Sort of, we talked a bit about supplements now. So, are there any particular medications as well? Obviously, you did touch on it, that some of the supplements can work as well as sort of medication. Is there anything you would prescribe necessarily you do find helpful helping pets live longer?
Absolutely. When I look at the way the best way to help our pets, and I've spoken about the variety of different ways, that an integrative approach is best. And so I always start by looking at diet, as you and I have talked about. I always start by looking at a pet's lifestyle, what you and I can do to avoid stressing those joints, for instance, by reducing trips up and down the stairs or making sure that your pet does not slip and fall as they come running to you when you get home after a long day of work. And then there is a place for your neighborhood veterinarian, and that includes the dental care, the anesthetic dentals that you and I spoke about, along with diagnostic blood and urine tests. There is a place for the supplements that we just spoke of, and there is a place for prescription longevity drugs. In particular, the drugs that I would choose to speak of right now are a drug called rapamycin and a second drug called acarbose. Why rapamycin? Because it's been proven in every mammal species studied to date to increase lifespan by up to 14% by itself. And how does it do that? It does that by reducing cancer risk and by reducing inflammation. The second drug that I spoke about, acarbose, is even more interesting because it's a commonly used human diabetic drug, but studies have shown that it can increase lifespan by an additional 5 to 7% when used with rapamycin. But here's the catch with acarbose, only in males, only in male dogs. And so there's a big long, or male cats, but just the males of the species. And so rapamycin works to improve lifespan by up to 14% in both sexes in every mammal species studied to date. But acarbose is a little bit more specific and it just benefits the males.
Now, that's really interesting. I think it's hit on a point I just thought of really that people sometimes speak to friends, family, or see websites, see TV programs, and they hear something, but actually it might not necessarily work for them or for their animal, and everyone is different, aren't
Mhm.
they? So obviously females of any species are different physiologically to the male species. That's interesting.
Yeah.
You've touched on that. It's yeah.
Yeah.
So um, is there any particular lifestyle modifications you sort of recommend to help to the integrated approach about diet and medicine supplement? Is there any other sort of lifestyle modifications you suggest to people to consider for their pets to help them live longer?
Yeah, yeah. And so this is going to tie back into the discussion of obesity and large breed pets that you and I spoke about. The reality is, honestly, it's probably less important for a small Chihuahua or a Pomeranian or a kitty than for dogs. But if you have medium to large sized dogs, for instance, and if you and I lived together, Suzanne, and we were building a house for the best care of our older medium to large breed dog, I would tell you it would be a one level house without stairs. It would be a house that had carpet in it from one end to the other so that our pet did not slip or fall as they ran to greet us at the end of a day or, as they ran to a food bowl, as my little puppy does. And so these are simple little things. But at the end of the day, think about how many times. I mean, when I talk to pet parents, some folks go up and down the stairs 20 or 30 times a day, to do the laundry or to go to a study or whatever the case may be. And every time they do that, their dog or their cat comes along with them. Well, that's cumulative wear and tear on that pet's spine and that pet's joints. So if you and I look at that integrative approach that you and I spoke of a little bit earlier, one of the ways to minimize joint problems, to minimize spinal problems, is to do whatever we can to keep our pets on one level and keep them from slipping and falling. For kitties, one of the things that we know for sure is that the more times they jump up onto a cabinet or onto a piece of furniture and then jump down onto a hardwood floor or tile floor, there are studies that show that these kitties are much more prone, to wrist or to elbow arthritis simply by virtue of this downward impact on an ongoing basis. So if your cat has a designated piece of furniture that they love to jump up on, maybe think about folding up a blanket and look at their landing pad. What can you do as a pet parent to minimize that concussion as they jump down? And that again will add months to years to your kitty's life.
Yeah, it's really simple things, isn't it? I know my dog I had, touching on your point about carpets, I had got laminate flooring, and the dog I had who was elderly, the physiotherapist recommended I get some mats, which I got some mats, only cheap mats, bits of mats from a sort of homeware store, and it just gave him somewhere to walk in where the laminate was. So it doesn't sound much, does it, actually? But and people think slipping sometimes is a bit fun, isn't it? I think that's that people's perception of what is fun or it's funny seeing maybe someone slipping around a bit, but actually it's putting a lot of strain, isn't it, on the joints and the.
Absolutely. You're exactly right. I mean, one of the things that I recommend is just, yoga mats. If you have a couple of beat up old yoga mats that are no longer suitable for you in your yoga classes, well, lay them down. I will bet you a six pack of the best beer in the UK that virtually every pet parent can identify your pet's traffic pattern. In other words, they come from the hall and they turn right to go into the kitchen and or turn left to go to the door or whatever. And wherever they change direction, it would be wonderful if you could put a beat up old yoga mat down there or a rubber back throw rug of some type that you can buy from a cheap neighborhood store in an effort to prevent those slips and falls. Because not only are those slips and falls not funny to your pet, but their damage is cumulative. Every time they slip, every time they fall, they are incrementally worsening their joint pain. They're incrementally worsening their spinal pain. And these things add up over time, Suzanne. So you're exactly correct.
Mm. Is there we talked a bit about sort of different cats and dogs. Is there any particular differences you find between cats and dogs in terms of or any other animals in terms of what challenges they might face or in terms of treating them as they're getting older?
Well, let's be clear. Both dogs and cats, and every breed of dog and every breed of cat carries their own health risks. And so, for instance, Persian cats are very prone to kidney disease, and Doberman dogs are very prone to heart problems. I had a Bernese Mountain Dog one time, and he was the love of my life, and he, like every Bernese Mountain Dog, is very prone to cancer. And so these are breed-specific issues that every breed has. And one of the things that I encourage pet parents to do your research before you buy a puppy, before you get a kitten. Do your research so that you know exactly what kind of health issues they are facing. Because just like with human medicine, one of the things we know, Suzanne, is that if I'm running into a health issue, the earlier in life I can catch it, the better my chances of beating that, or at least minimizing the progression of that particular disease. And so if you know what disease your pet is prone to, let's start testing for that early in the game. And 2 or 3 or 4 years of age is not at all too early to start that testing. So with kitties, one of the things that many pet parents learn the hard way is that 1 out of 6 cats it will develop a heart problem called hypertrophic cardiomyopathy, or HCM. And the way that that is typically found, unfortunately, is late in life when your veterinarian just puts on a stethoscope and listens to your pet's heart and finds, oh gosh, your cat has a heart murmur. But if we can catch that earlier in the game, there are drugs that you and I can use to prevent that from ever becoming a problem. And so early detection counts.
Hmm. Yeah, I think that's as you were talking, I think led me to think about actually that prevention, isn't it? And I think people sometimes wait till an ailment appears, or maybe like we talked about the carpets or hard floors and stuff. Actually, you could do
Hmm.
things earlier. Don't wait till your animal's older and struggling to change to more mats.
Absolutely.
Isn't it? And people testing, it's doing that preventative approach, isn't it? Rather than if you can, that part of the holistic method, isn't it? Not necessarily waiting till something is an issue, to trying to think from as broadly as you can, early as you can. Do you agree?
Right. And listen, I understand that many pet parents can't afford regular testing. And so, there's kind of a tiered approach. And you and I have spoken about this already. But if no matter who you are, you can take a look at the quality and the quantity of the pet food that you are feeding your dog or your cat and see if you can reduce that or maybe increase the quality a little bit. You and I can absolutely buy a cheap child's gate at Walmart or whatever the equivalent is in the
Mm,
UK and prevent our pets from going up and down the stairs 10 or 20 times a day. You and I can look at helping cushion where a dog or a cat jumps from that sofa down onto a hard floor. And so there are things that we can do without spending much money. But there are things that we can do that if you have the financial wherewithal, that will really pay dividends for your pets. And these prescription longevity drugs that I have spoken about, like rapamycin, is one instance of that. And in both the US and the UK, there's increasing evidence, Suzanne, that doing blood and urine tests early in the game so you can identify health issues before they really become a lifelong problem for your dog or for your cat it makes a big difference. I mean, you and I, if we can catch a disease early in the game, you and I have a much better chance at altering or delaying that disease. So you're exactly correct.
mm. That's great to hear. I was one of the things I thought of it earlier when you were talking, and obviously you're really passionate and specialist now in the older pets, and obviously I know vets work with pets of any age or animals of any age.
Mhm.
But do you think there's more of a more of an increasing awareness of the different modalities you've talked about really with vets? Because obviously I know sometimes it's hard to keep up to date with what's happening, isn't it? And do you think there's, oh, you can't speak for everybody, but do you feel there's a growing awareness of the differences? And like you said, the glucosamine isn't seen as being working now, whereas probably before, and maybe still some now, I don't know, it probably still is. Do you think there's a growing awareness in the veterinary world about these different changes and looking after older animals?
No. No, I do not. And I'm going to tell you why. I believe, unfortunately, that small animal veterinary medicine is broken, at least here in the United States. And perhaps in the UK, it's a different story. But I would tell you that in the United States, Suzanne, the days of an individual like me owning a veterinary clinic are numbered. Now, almost two-thirds of veterinary practices in the United States are owned by big corporate enterprises. And one of the most, the single biggest is the company that makes Mars candies. And they own a number of different veterinary chains. But the moral to that story is that they are now enforcing a time limit. You can only spend 20 minutes as a veterinarian visiting with your pet parent. You can only use these drugs. You can only use these supplements or these vaccines. And so, as these corporate entities take over veterinary medicine, the reality is that I think our patient care suffers because the listen, veterinarians, and listen, I am a veterinarian, and so we're hell on wheels. If you want us to suture if If your dog comes in with a cut, we can fix that, Suzanne. If your kitty comes in with an abscess, we can fix that. We are great in reactive medicine. But what many veterinarians are not great at is taking a proactive look at your pet's longevity, being able to sit down with you on the floor and talk about not just the next month or two, but the next year or 2 or 5 years of your pet's life and how best to optimize their health. Unfortunately, I don't see that changing in the near future. And so in direct answer to your question, many veterinarians simply can't have the conversations that you and I have just shared on your podcast.
Hmm. That's interesting, and what you've talked about the big corporations owning more veterinary practice. That's something that is happening in the UK, and there's some activity going on currently, a national consultation about that and the and the impacts, because it's something that and a bit more transparency, I think, isn't it? Sometimes people don't, and they can not necessarily, they're not always a bad thing, are they? However,
Yeah,
people need to know and make informed decisions, don't they? And I don't think sometimes it's as clear who owns what, and and actually
right.
if you've got the same
You're
chain
exactly,
maybe owning a few practices in the same town, then actually it doesn't matter which one you go to, really. Probably, obviously, the
no.
individuals treating your animal will be different, but the actual premise within which they're working is going to be the same, isn't it? So yeah, it's something that's in the UK about spotlights on that as well.
You're
So
exactly correct.
mm, mm.
You're 100% correct, Suzanne.
Yeah, yeah. So yeah, I'm very grateful for you coming onto the podcast so we can talk about this, and obviously it's getting people
Okay.
to think, and hopefully it's giving people lots of good ideas to think about for their own animal, whether their animal's older already or a younger animal, and obviously planning for their future. So is there any sort of closing comments or sort of parting top tips you would give to listeners in caring for their animals?
Well, it sounds like what they need to do most is listen to your podcast. It sounds like you've devoted an awful lot of time, an awful lot of energy to helping educate pet parents in the UK. And so my hat is off to you, Suzanne, because I know exactly how hard it is to have a weekly podcast and to keep finding different topics to talk about. And so I hope your pet parents really appreciate how much work and how much knowledge you put into this.
Thank you. It's very kind of you to say so. Appreciated. Thank you. Okay then. Well, can you give people your website again? So to just say, oh, so I'll put it in the show notes, and but if you could give people your website so they can find you and look at your resources.
Absolutely. So I'm going to give you two different websites. My primary website is www.helpingpetslivelonger.com, because that's exactly what I and my team do 7 days a week. We work like heck at helping your pet live their longest and best life. However, one of the things that I'm going to do, I'm going to extend an offer to your listeners, the pet parents who listen to your show, Suzanne. And I've set up a separate website called www.freevetcall.com. And listen, I understand that the UK, that's a long distance number and the like, but I have a calendar set up on there so that any listener can go to freevetcall.com and set up a 10-minute appointment to ask whatever questions they like about their pet's health and their pet's longevity. There's no charge for this. We are all in this together, you guys, and I will help you if I can. So go to freevetcall.com and let's get you signed up.
That's great. Thank you so much. Hopefully, your listeners, you'll take advantage of that. And thank you so much. It's been great to
All right.
talk to you. Thank you.
Thank you, Suzanne. It's a pleasure visiting with you.
I hope you found that an interesting episode of the Animals Naturally podcast, finding out more about Dr. Kevin Toman's work with animals. And you've now got some different ideas on how to help your animal live a longer, happier, and healthier life. If you know of anybody who would find this interesting, then please do share this episode on to friends and family. In the meantime, if you have any general inquiries you'd like to know about holistic animal health care, then please do visit my website at taranet.co.uk, where you can find lots of information, free information and advice on how to care for your animals more naturally using a holistic approach and complementary therapies. You can also, of course, find many more episodes of this Animal Naturally podcast, which gives you different tips and ideas on how to help your animal in a variety of ways. I hope you found that all helpful, and until next time, thank you for listening. Goodbye.